Well, good afternoon, everyone. It is good to be back, at least virtually, with everybody here at the workshop. Thank you for attending yet one more virtual presentation here. Hopefully not too many more as we try to end this very weird year and a half that we're having. What I have for you today is a working project with John Gordner and Orgel Osterk, who are both at the University of South Carolina. It's kind of a derivative project of something that I presented to the workshop in August of 18, which I'll reference here again in a second. It's one of these projects which I think is great for a workshop like this, in that I feel like it has a place. It's not super clear to me what the exact place is, so I'm grateful for any feedback, both about the appropriate ways to try to look at it and maybe try to improve the paper some. So any feedback's really appreciated. All right, so as you can tell from the title, we're going to be looking at SNAP, or Supplemental Nutrition Assistance Program, benefit timing. So just as a quick background to make sure everybody's on the same page, talking about, if I can get my slides to, are they? There we go. So Supplemental Nutrition Assistance Program, which better known as the food stamp program, is a federal program which I think everybody is aware has a goal of providing food purchasing assistance to low-income households. It's a federally kind of funded program, but it's run by the states. And a key element of change about the timing or receipt of benefits occurred in 1996 with the Welfare Reform Act, which put everybody into this electronic benefit transfer system. And this is the system whereby SNAP recipients have, in essence, a debit card. And what's key for our thinking today is that whatever day is the food stamp receipt day for a particular household, we know that they're receiving their benefits. They get populated to the card on that day. But also important is that regardless of how many days a state treats or provides benefits, any particular household only receives its benefits on one day, regardless of the state. And so the other kind of important or salient point is that states are free to determine their own distribution schedules for SNAP benefits. So this creates a lot of heterogeneity or variation in a number of ways. First, if you take a look here, the number of days in the month that food stamps are distributed varies quite a bit across states. So if you look, you've got, and this is like circa the end of, or beginning of 2019, you've got around 7 states that are distributing all of their benefits on one day. So 100% of households are getting their benefits on one specific day per month. All the way up to the max, which is this one state, which is Florida, which just a couple of years ago moved to 28 days. So they distribute benefits to 1/28 of their food stamp population every day from the 1st to 28th. And then the modal number of distribution days is 10. So a lot of states, it looks like about 18, are distributing across 10 days. The kind of geographical spread of the number of days you can see varies across the U.S. with kind of your traditional southern states and Midwestern states seem to have more distribution days. Kind of northern Great Plains, New England states tend to have fewer. But the number of days has also changed quite a bit over time. If we go way back, it's changed a lot. But in kind of more recent history, the data we're going to be looking at is from 2004 to 14. So these 2 years here kind of bracket in the middle of that. And just what I want to point out here is, if you look at states are drifting towards more days, not less distribution days. So in 2006, there were 38 states or localities that distributed SNAP in 10 or fewer days. And in 2018, that 38 had come down to 28. So states seem to be increasing the number of distribution days that they have in a particular month. And
Question?
then another, yes, Jeff.
Is there some sort of history here? Right, there's a literature in political science on sort of policy learning, and there are institutions, the National Governors Association and things that sometimes will come up with ideas about how everybody could be better. And that will generate a big wave of changes at the state level. Or sometimes one state will do something and neighboring states will get the perception that it seems to be working. And so it will spread kind of geographically because states have a lower cost of learning from their neighbors.
Yep.
Is there that kind of backstory here to tell?
So a little bit of the latter, but a lot of this initially came from the grocery stores. So the big grocery stores were pushing for, you had a situation where most states were distributing their SNAP on one day or maybe a couple days. And the grocery stores got huge runs on those days. And they didn't like that very much. So they lobbied to have more days. So because the state could very easily have spread out payments so that households got 2 payments a month. But instead, households are still only getting 1 payment a month. So from the household's perspective, there is no spread. But within the state population of food stamps, there can be quite an extensive spread now, where, like I said, in states like Florida, it's almost perfectly uniform across the whole month. But yeah, so I think the backstory is more motivated by grocers.
Okay.
For what it's worth. The other kind of, I think, kind of important aspect here is about timing is the nature of the stagger. So states vary on the particular days of the month in which the benefits are distributed, even if they have the same number of days. So for example, both Rhode Island and South Dakota distribute 100% of their benefits on a single day of the month, but Rhode Island's is the 1st and South Dakota's is the 10th. So there's this, which days within the month also varies. And similarly, for states that distribute across many days, you get all kinds of patterns. So the most common thing states do is distribute consecutively. So I think the modal number of days is 10, but the modal distribution among all choices is the first 10. So it's a consecutive distribution. Now, but other states have much more staggered. So like in Wisconsin distributes on 10 days, but it's the first day of the month is not a day, then the next 2 days on, then it's a day off, 2 days on, day off, until you get to the 15th. Texas, and most states have some kind of a pattern that they follow, at least it like feels like they chose something non-random. Texas is, of course, Texas. So Texas distributes the 1st, not the 2nd, the 3rd, not the 4th, but then the 5th, 6th, and the 7th, not the 8th. It's just all over the place. But they're
I would
also
have thought Texas might skip Sundays.
No, so that's another thing. I've got some past research that looked at the fact that sometimes a household's getting benefits on a Saturday and a Sunday, sometimes it's getting it on a Tuesday. When that seems to, we find that actually matters for alcohol consumption. Even though SNAP doesn't cover alcohol, it's just an income transfer. So, anyway, now I'm off onto a different thing. But so the project's going to be looking at timing in some way. So I just want to give everybody a little bit of background about the timing. Now, some motivating literature for this general concept, it starts with thinking about the SNAP benefit cycle and food insecurity, right? So we know that the goal of SNAP is to alleviate food insecurity for low-income households, but there's been a lot of research about the benefit cycle. So a specific household's benefit cycle is stated to begin the day they receive their benefits and ends the last day before their next installment of benefits. So a particular household benefit cycle can vary depending on within the calendar month when it starts, but depending on what is their specific food stamp allocated day, whether it's the 1st of the month or the 15th of the month or something else. Now, there's been a lot of research that's looked at how within a particular household's benefit cycle does it affect their food insecurity. And we find there's a good deal of research that suggests that SNAP households fail to smooth their consumption real well. These are income-constrained households, not terribly surprising. So they tend to spend their SNAP benefits anyway pretty quickly. Some research has shown that as much as 50% of the SNAP benefits are exhausted within 3 days. So, there's definitely not spreading out the SNAP benefits. And consequentially, there's been research that's shown that this kind of single monthly treatment leaves households in a nutritional deficit or in a caloric deficit towards the end of their benefit cycle, their respective cycle. So Shapiro finds about a 15% decline in caloric intake over the course of a household's specific monthly benefit cycle. A recent paper by Gregory and Smith finds that the likelihood that an individual on SNAP is classified as food insecure is much higher in their respective benefit month. And households are much more likely to have a day with no food later in their consumption month. So we see that there is this lack of smoothing within the benefit cycle. And there's a host of research that's then looked and said, well, what are the potential consequences of that, of this benefit cycle lack of smoothing? And so some examples are Foley and Carr and Packham have found that there are more financially motivated crimes later within the benefit month. Jasmine Pines and Bellows and other research that John and Orgul and I have done have found effects within educational settings, increased student disciplinary incidents later in the food benefit cycle. We actually were able to look at specific data from South Carolina where we know the students' standardized test scores and the day that they took their test, and also know what the specific day that student's household receives food stamp benefits on, and can show that because standardized tests are all given on the same day, students in the same classroom may be in different parts of their benefit cycle just because of the random nature of the date in which their household was assigned food stamp receipt. And we can find that actually made a difference even within students because it changes from year to year, even though their food stamp cycle doesn't, changes the date of the test. So there are these known relationships that seem to be related to these food insecurity issues that the prior research has found. And that brings me to this project I presented in August of 18 to this workshop, which, by the way, I got such great feedback from. And so this paper was published last year in the journal Health Economics, and it looked at food stamp timing and emergency room visits, again, using South Carolina administrative data. But one specific finding of that paper was that the benefit cycle was related to ER utilization, specifically of older adults, or not seniors, but older non-seniors. But there's a big but here coming, right? That these kind of like late in cycle long wait effects only showed up in households where the timing of their benefits was aligned with the calendar month. What I mean by that is you have some households in South Carolina that were they by random chance, their food stamp date was like the first, second, or third of the month. So it's highly aligned with the calendar month. And then there are other households that were later in the month, like the 10th of the month, and find that those households were much more misaligned. And it was only the households that had a high degree of alignment with calendar month where we saw these ER utilization things, kind of suggesting that maybe there's some interplay or relationship between alignment with the benefit and calendar cycle. So that was kind of like one element of motivation. And other work in this area has kind of started to find this similar sort of interplay present. So some recent research has found suggestive evidence that this alignment with SNAP benefit timing with the calendar month seems to matter. So another paper that looks at healthcare utilization, Arteaga et al., a paper by Allen and Atwood that looks at drug overdoses, another paper by Carr and Packham that looks at domestic violence. They all kind of find that suggestively, at least, that alignment of benefits cycle with the calendar month seems to matter. That it seems that whether or not you get your benefits later might be important. And so it's kind of hypothesized that maybe because there's this definite income availability cycle that's correlated with the beginning of the calendar month, we know that there's all this research from Stevens and others that shows that people get big influxes of income at the beginning of the calendar month, both income and transfers like TANF, things like that. So there's this suggestion that maybe if you happen to receive food stamps or SNAP later in the calendar month, it might create some forced smoothing. I don't know. But everybody, we all kind of hint at this when we find these alignment issues. So that brings us to this concept that I'm sharing with you today, which is, well, we all kind of suggest that maybe that's what's going on, but do we see any evidence that distributing SNAP benefits later in the month smooths high frequency, this kind of non-durable consumption patterns? Do we find that households that receive their benefits later actually do have smoother consumption patterns? This is a tough question to address because you need to have data that measures kind of high frequency, non-durable consumption, not just SNAP consumption. So SNAP consumption is really hard to find, but that, broad consumption at the household level. And then you'd also have to know specifics about the household food stamp receipts. And so we can't quite get all that together, but we can kind of get some of it together. So I want to see if we can at least find some evidence consistent with and get what your guys' thoughts. So,
Chad?
Yes.
It's Wisconsin, so I feel obliged to ask about the model that you have in mind. Is this kind of a mental accounting idea that somehow, if it's aligned with the calendar month, that people know exactly when they're going to run out, or is this kind of other things happen, like if suppose that some of these folks are on TANF, if they're getting their TANF on the 1st and the food stamps on the 15th, maybe that helps them smooth relative to people who get both on the 1st. Is that the
I
kind
think
of
it's the latter.
Is that?
Yeah, go ahead.
Do we know in these states when other stuff gets sent out, when UI gets sent out, when disability gets sent out, when TANF gets sent out?
So TANF will be the beginning of the month.
Okay.
And I think one of the things that we could add is a finer understanding of every single sort of transfer that could occur. We haven't quite gotten to that part yet, but one of I think the general identification that we're hoping to kind of get at here is the only thing that's really should be dramatically different is, now to your point, the policies could be different in a correlated way. Absolutely. But across all the states, when we look at, well, I'll get to it in a second. I guess
okay.
I'll get to the model, the empirical thing. So the data set that we turn to try to see if we can get some evidence out of this is the Nielsen Consumer Panel. So if you're not familiar with it, it's a great data set. So it's a panel of household level scanner data that the Nielsen Corporation put together. It's all food and non-food, non-durable items purchased. It's at the UPC level. So it's very specific. It gives us information of when the items were purchased, where the items are purchased, the type of store, the price. And so lots of different channels are provided. So examples is grocery store purchases, discount big box purchases, liquor stores, dollar stores, etc. The data is reported in basically virtual real time with these home scan devices that Nielsen issues to its participants. And it looks like that. It kind of looks like a fancy calculator. And the newer ones, I think, are actually just a smartphone app. But it's all 50 states and major metro areas. It's the years we're going to be looking at are 11 years from 2004 to 14. There's about 40,000 households in the couple earliest years, and then 60,000 households in the later years. And households will continue on from year to year. So you get this kind of longitudinal measure. And so ultimately, we're going to have about 6.8 million household year, month, day observations of spending that we can look at for each household. Now, our kind of like key measure here is we're looking at total expenditure. So like there's a field in Nielsen that gives you total expenditure for each shopping trip. And it's based on actual expenditure that's at the bottom of the receipt. And the reason why that's important is you could calculate expenditure for different categories, subcategories of the Nielsen by just taking price times quantity for the group. The problem with that is, and it's another limitation of using the data for this sort of question, is that the prices in the NCP are either self-reported prices or they're more commonly the average price of that item that week at that store, not specifically what that household paid. So they had coupons or they were taking advantage, so that wouldn't work. So we utilize this total expenditure for the shopping trip because that's a known thing and going to use the real prices to build up to that. And then what we do with it is we aggregate all the shopping for a particular day in a particular household together so we can get the daily expenditure for that household. And then we calculate the daily average expenditure for each household for each week we observe them, and then for each month that we observe them. So we get this kind of daily, and that allows us to get around the problem that like the quote unquote fourth week of the month has different numbers of days depending on what month it is and what year it is for February. So that kind of standardizes that a bit. Now, there are two kind of fundamental limitations which we want to recognize that we try to get past, but they're there. One is the NCP doesn't tell you if a household is currently receiving food stamps. What the NCP does do is it provides us enough information to determine if a household is likely eligible for food stamps. So the population we're looking at here is kind of intent to treat population. During this time period, 70 to 85% take-up rate, but there's going to be some portion of households that we define as treated that are really untreated and should really, and therefore would have a zero effect to the effect that there is, to the reality that there is an effect, and that will be considered treated. So we kind of have to understand the limitations of that and what that will do to our estimates. And then the second thing is, because we can't tell if a household is actually getting food stamps, we actually wouldn't know specifically what day of the distribution days in the state they live in they receive their food stamps, unless they're in one of the states that distributes all on one day, in which case then we would know. So what we do know is we know we're going to be trying to look at states as a treatment that distribute more of their food stamps later in the month, or there's more misalignment. So we calculate the probability that a household is treated on a specific day because it's relatively uniform distribution across days. And therefore we know like what percent are distributed like within the first week and what percent are distributed later in the week. So you can get kind of a dose effect, or you could use like the median distribution day. So I'll talk more about this in just a second. Anyway, to start, what we did was just wanted to just kind of get a feel for what we were looking at. So we started with a kind of a descriptive analysis. And I've never really looked at household spending this way. So we thought, it'd be interesting is just to kind of look at how on average households behave across the month. So the first thing we did was for each household, we calculated the average daily expenditure for each month we observed them, and then for each week of each month that we observed them. And then for corresponding weeks that match their months, or weeks within months, we calculated this ratio. So it's the average daily expenditure per week over the average daily expenditure for the corresponding month. And the idea there is that a perfectly smooth, non-durable spending across the month, you should get each week a 1.0, right? So if you're above a 1.0, then that week, that household spent more on average than they did for the month on average, and so forth and so on. So it just kind of gives us some measure of smoothing in a descriptive sense. And to kind of give you guys a feel for this, this is just all the households. It's not SNAP households. It's all households in the whole NCP that we observe. And on average, what was the spending ratio across all households in the first week of a calendar month relative to the second week, the third week, and fourth week as a ratio over monthly spending. And what we see here is, by and large, on average, households are pretty smooth, right? There's about a 2%, they spend about 2% more in the first week of the calendar month and about 1% less. So the spread there is about 3%. Again, just descriptive, nothing conditional about it. So then what we did was we said, all right,
do you use all months in this? Because you could get different patterns, right? When it's school
they
break,
all look the same, but December.
The Christmas holidays?
Yeah, I've got December at the end. I'll show you, Bobby. It does look very different. But we are using all the months at this point.
Question?
Yes.
Has anybody food is a non-durable in some broad sense, but within the category of food, there are things that last a day and things that last a week and things that last for years. Has anybody kind of drilled down into that?
We haven't drilled down into the food items specifically. We can do that. It causes this other issue with the fact that we don't know exactly what people paid for the food.
Right.
Yeah, so it's a bit of a trade-off. But I think that's a good place to look.
You had a statistic earlier about people spend 50% of their SNAP money in the first couple of days or something. If people buy sort of staples and canned goods at first time and not other times that they go shopping during the month, then that might be perfectly reasonable and consistent with, in fact, smoothing food consumption over the course of the month, right?
Okay. And what we expected based on the literature was that we would see a dramatic drop in expenditures within the food stamp population. And that's so we did here in this table I'm showing you is the top panel is people who are food stamp eligible. The bottom panel are people who are not. And so we were finding something consistent with those who found these large declines in caloric intake and food insecurity at the end of the cycle. We should see a big gradient here, and that's what we found. Like if you look at this, that spending ratio, it's 8% more the first week of a month and 7% less on average the last week. So there's this 15% spread. Again, it's just average. It's just not unconditional. But then when you look at the non-food stamp households, you don't see that.
Interesting.
And so the non-food stamp households are not really income constrained in the same way. And so people go shopping when they need food. And it looks like, or when they need stuff, toilet paper, Kleenex. I don't think that, we think about these things in the same way, but low income constrained. So this top panel was very consistent with that other research found. Again, just descriptive. So now, in order to try to take us to this place about does this alignment matter, before we get to the regression component, we wanted to also look at the data this way, using that kind of alignment question. And so we had to make some arbitrary choices here. So this is completely arbitrary. But what we did was we just kind of classified households that were in states that had limited, moderate, or significant amounts of spread throughout the month. And what we mean by that is we classify households in states that were subjected to where 70% of the state's SNAP population or more, 70 to 100%, received their benefits in the first 7 days, the first week of the month, as being limited stagger or limited amount of distribution. Moderate is 40 to 69.9, and then a significant amount of stagger or misalignment for states that had less than 40% treated in the first week. So 60% or more treated after day 7. And you can see the percentage of how that breaks out. And then what we did was, just for this descriptive analysis, we just compared the limited to the significance, just to see if there was a notable difference, right? So here we have, again, top panel is the SNAP eligible households. On the left, we've got the highly aligned, the kind of limited stagger states, and on the right, the significant stagger. If we look at the limited, you get this pretty big spread, 1.11 down to 0.92. So nearly a 20% decline from the first week to the fourth week. And if we look at those states that had a much more misalignment, the average household in those states, still a big drop, but it's smaller. And those are statistically different from each other. And then if we think, well, maybe there's something going on between these states, are maybe different in some way that is different across not just food stamp populations, but everybody. So we looked at the non-eligibles, and those are virtually the same. So nothing really happening there. Now, of course, there's a big flaw in our potential inference by comparing these SNAP eligible households between these two groups, which is you can imagine a scenario where, imagine that all people receiving food stamps have the exact same calendar month, or sorry, benefit month smoothing pattern. So they all, if their expenditures go down throughout their benefit cycle month. In a state that has, if you compare a state where everybody's treated on the first, everybody's on the same cycle, to a state where half the population is treated on the first and half is treated on the 15th. And again, individual households all have the same exact cycle, but you're now averaging them. It should look somewhat smoother. So this evidence here we thought was consistent with this concept that others are finding, but it doesn't necessarily demonstrate that that's what's actually happening, right? And so that's why we'll need to move to some type of regression analysis to hopefully get at this a little bit. And so I'll use the last kind of like 12 minutes or so to try to walk through that and see what you guys are thinking about how we could help this. So we're trying to use some kind of a triple difference in quotes, fixed effects design to address this. So let me walk through the pieces. The left-hand side is going to be some measure of household level smoothing. So we're going to be looking at things at the household level. I'll talk about a couple examples for what we're going to use here before I show you some of the preliminary results. Then we're going to have some treatment, which is some measure of SNAP distribution within the state that the household lives in. So it's trying to get some measure of misalignment. The blue here is it a SNAP eligible household or not? And so the interaction is going to be what we're interested in. And then we'll have time and location, and in some cases, household fixed effect. So two examples of things that I'll show you results for that we use as left-hand side variables. One is just this kind of crude difference between week 1 and week 4 spending at the household level. And then another one is standard deviation of weekly household spending. So we flip and flop those out. And then two different examples of measures of kind of misalignment or snap distribution that we flip in and out are, one is the median snap distribution day in a location at a given time, and Hamrick and Andrews use the same measures where we took the idea from. And so, for example, if you're a household in New Jersey distributes on the 1st, 3rd, and 5th. Those households, their snap distribution value would be a 3. If you're an Alabama household, Alabama distributes from the 4th through the 18th of the month every day. So the median there is going to be like the 11th of the month. And so do we find that households that are on average treated in states later seem to have better smoothing characteristics is the basic idea. All right. So what are we getting at here is, first, I've got two panels here. First one is where the dependent variable is the measure of smoothing here is just kind of that difference between average daily spending from the 1st week to the 4th week of a calendar month. And the second one is going to be the standard deviation of weekly household spending. Our treatment in this first case is that median snap distribution day. So we got 3 columns here for this first one, and that's just increasing the fixed effects. And so what we would expect to see here is as the state's median distribution day increases, the average household is receiving its benefits more misaligned with the calendar month. So if that's leading to more smoothing, we should see this value go down or be negative, and that's what we're observing, right? That the gap or the spread between week 1 and week 4 is shrinking. And in week 3 here, this is with household fixed effects. So the identification here is only coming from households that are in states where the state itself changed its distribution scheme. And then in the second panel, we're looking at the standard deviation, same kind of story. And the magnitude here is about a 6.5% decline in the standard deviation. So it's not massive, but it's not nothing either. So again, this suggests that the states that distribute their benefits in more misalignment, you're seeing households are smoothing a little bit better. Here, it's the same exact analysis, except we're using that percent of SNAP treatment days after week 1 is going to be our treatment. So in essence, this is the probability. The treatment here is in essence the probability you're treated after the first week. That's basically the way that you could think about that. And it's a very similar story. We get negative effects on both of these measures that these households seem to be using these measures of smoothing a little bit better. So that's kind of what we find. I'm grateful for any feedback that anybody has. I feel like the project needs some thought. It needs some work, and I was happy to share it. I saw the email from John and Jason about it doesn't matter how bad this is. You bring it, and we'll see if there's anything we can do. And this is just kind of this thing I've been kicking around, thinking, I feel like there may be better measures, ways of getting at this alignment, or better measures of smoothing. I'm also finishing my 6th year as department chair, so the amount of RAM I get to allocate to these things is about to go way up, and I'm really excited about that. If anybody has any thoughts, I'm happy to take them now. I'm happy to take anything via email that anybody might have. So I'll check the chat. I also really very much look forward to this view in the summer. So I don't know if anybody's got any comments. Let me see what there's anything in the chat.
Chad, I have a question about, because you see the same households month to month, right?
Yes.
I was pondering how much you could do with the fact that like precisely what dates they go to the store, and think about the households that seem to go exactly on benefit days for their state, and they do it regularly, as a way of separating households who are likely treated on those days.
Mm-hmm. Yeah, actually looking at the specific, like we could use it we could calculate some kind of like likelihood measure based on their spending, because we do know definitively from administrative data, some work that we've done and others, that there's a high likelihood households go to the grocery store, specifically grocery stores, on that day. And since we can identify channels that are grocery store channels, like we can see spending at grocery stores different from other stores, or stores that sell groceries. So I guess you have to include like Targets and Walmarts, but I think we could definitely increase the likelihood that we're looking at food stamp households. I think that's a good suggestion.
If you, I mean, like one basic way is just to ask what proportion of households regularly go exactly on benefit days, right? Like if you see them every month, you know, the ones that, and you have so much interesting variation because there's across states, you know, that there's different days, and then by every month, there's a different day of the week that the benefits are, you know, there's a lot of different variation that when you see, you keep on seeing the same household pop up exactly when you think they should, if they are on the benefit, that could really separate, instead of using only state variation essentially by like these median questions, and like you could really maybe really hammer in on or focus in on households that are very likely to be exactly the ones that you want to have in your analysis.
Yeah, I think that's a really good idea, because as I set it up, just what I presented to you, the biggest kind of leap you have to use is we're using kind of, in essence, average household outcomes to get at these things, saying, well, households on average here are more smooth than not. But if we knew there's specific SNAP date with a degree of likelihood, then we could really just compare. You could even compare within the same state, right? And I forgot that I wanted to share this. Please, if anybody else has another comment.
I didn't mean my comment to be dismissive. I thought your evidence so far was quite persuasive. I think what I take from what you're saying is that the results are much larger than what you can find because of all the various averaging that you have to do.
Yeah, that's right. I think that to the extent that we believe the results, they would be attenuated for a number of reasons, both by having some people who are definitely not treated at all, but they're not even in the food stamp population in there, and then because of the averaging. Bobby asked about different months, so I just wanted to show you guys December because I have it in here in the slides. So this is December spending pattern. You can see it's quite different for everybody, as you might expect. And the results don't change meaningfully if we drop December, because everybody, it turns out, in December is weird, so it just kind of like knocks itself out in some ways. It affects the descriptives a little bit, but not enough to make a difference in the story. One other thing that was interesting is that in 2011, Michigan and North Carolina both kind of switched from a pretty early in the month schedule to identically more staggered schedules. So we actually can look at comparing Michigan and North Carolina to itself. And again, this is just descriptive, but you can see that when Michigan and North Carolina, their average spread went from 13% to 10%. But in the triple, if you do an old-fashioned triple difference on this, you actually get a statistically significant difference. So even just comparing those households in that state to themselves. All right. There were some comments in the chat. I didn't bring a co-author, which I've learned is what you're supposed to do with these things.
It's only in chat because we didn't think or at least I didn't think my question was important enough during the talk. But basically, like, so to Jason's point about like trying to better target who is liquidity constrained, I guess in this paper, I was wondering if you could find some variation from these previous papers that use this three paychecks in a month versus 2 paychecks in a month. Like if a lot of these individuals are paid every 2 weeks, there's, I think, quite robust findings that people act differently in those 2 months of a year, which feature 3 Fridays versus 2. So one of those people doing that research is Iwei Zhang at the University of Wisconsin, but like she finds, interestingly, I think, extra durable spending in those 2 months. But I think
like a free paycheck.
Yeah, and so like, does that interact with, because the SNAP or these benefits are kind of smaller in those months, right? Because the months are longer. But on the other hand, you get an extra paycheck. So I guess it could maybe help identify, like, are people constrained specifically by the benefit versus their overall paycheck. I haven't thought it through, but I was wondering if that type of variation might be.
Yeah, I think both what you
useful.
mentioned and what Jason mentioned, I could even think of a way of putting those together to try to help figure out different sorts of, like you said, liquidity constraint kind of information. Are we getting moved to, we're getting moved to like 2 checks or bi-weekly checks or something, right? Is it bi-weekly or twice a month? Like, are we getting is it every other Friday or what do we do? What are they doing to us? Does anybody know? I love faculty because we ask these questions, we're like, we have no idea. Like the staff will all know completely what happened, but we're like, I don't know. Like, we just assume the money will be in there. I don't. We're in the bottom of that table. We don't pay no attention. Okay. Anyway, yeah. So that's all I've got. Thank you guys. I really appreciate that. If anybody has any thoughts, please feel free to email me. And Jason, I look forward to the next one of these being in the sunshine. Okay. See what you can do. Make it happen.
Yeah, this has been a great end of the semester. I share Shad's view. I think we'll, at least John and I will send out some queries about a terrace visit soon. I mean, the kids are clearing out of here in less than 2 weeks, so there's going to be a lot of good stuff, a lot of fun to be had. So look out for that. And thanks everyone for everyone's comments today.
Thank you.